This is phase 3 of the thoracic spine. First exercise is T30. This is the physio ball bridge. We'll demonstrate a few ways to do this. We'll teach the method with the feet on the ball. Patient has their back on the floor or on the table here. Hands are at a comfortable position to the side. If the patient needs to, they can use their hands to kind of help with balance and control. We'll start with the feet slightly apart. This will make one of the easier ways to do it. You'll lift the patient's hips off the table there. They'll hold for about 3 seconds or so, and then relax, and we'll work our way from 3 seconds to 5 to max of 10 seconds. Patient's breathing, nice and controlled breathing through this exercise. Next, we'll demonstrate with the feet together. This is the next hardest. This will challenge their core a little more. Again, 3 seconds, and work our way up from there. Next, we'll demonstrate with the bridge. They'll bridge up, and then they'll lift one leg off the ball. Hold for about 3 seconds, and we'll advance from there also. And we also rotate legs on this exercise. Control breathing. We don't want their face turning red or any of that. And that is the bridges with the physio ball there. Next exercise is the prone scap retract with weight. So in phase 2, we did this similar without weight. And so this one, we have the patient grab weights, hands are next to the side. Key the patient to kind of shrug their shoulders up, rotate back, and really squeeze those shoulder blades together as they rotate their arms in extension there. He has about 2 pounds. You can start with 1, 2 pounds, whatever office has the lowest weight there. You can really hold the weight for 1 to 2 seconds, and you can kind of advance with that also. Just make sure they have the proper positioning and form when they do this. And that is the prone scap retract, T31. Next, we will move the table out of the way. Next, we'll have Dr. Mike demonstrate the physio ball, quadruped, opposite arm, opposite leg. Patient has the ball, belly and waist area. He's straightening his back leg, opposite arm straight also. He's going to hold for the start 3 seconds and work your way up to 10 seconds in this exercise. The patient should feel their muscle contract on this side of the spine as well as this side of the spine at the same time. Head's relaxed, it's not an extension or straight down. And that is the quadruped, opposite arm, opposite leg with physio ball. To make this more challenging, you would just have him use about one or two fingers on each side. So he's on his fingertips there. And we'll kind of key that in. He's on his toes back here also. So we feel the core work at the same time using that physio ball. Next exercise, we have the physio ball prone tees with weight. So we'll grab the weight real quick. Patient again will be on their stomach. Feet are kind of shoulder width apart. The main focus is in between the shoulder blades here. He has palms down. He has 2 pounds in his hands. Arms are straight out. He's really squeezing right here between the scapulas. Then hold 1 to 2 seconds. Neck is in a relaxed position there. Just really squeezing there. So those are the prone tees on the physio ball. Next is T34. This is the push-up with the physio ball on the wall. We'll have the patient kind of make L's with their hands, thumbs are forward. We have the patient kind of have their body at an angle of the ball. And he's just gonna, this is demonstrating with the feet together, which is a little easier method. Towards the ball, he'll hold for 1 to 2 seconds, and we kind of advance with the hold there. And then we'll demonstrate with the feet together. This will challenge the core a little bit more, and all the stabilizers. Again, he's holding for a few seconds and then pushing back out. And a way to measure this on how close they are to the wall, you can set pieces of tape on the carpet. Just kind of keep those in your office at certain lengths, just where the patient can advance in this exercise. And breathing is key also, so they're not holding their breath. Next exercise is the Brugger's positioning with the eyes closed. So same thing, eyes are closed. Neck retraction first. We're going to have the thumbs rotate out. He's squeezing between the shoulder blades. He's going to hold that position for about 15 seconds. Eyes are closed. It will challenge their stability where they are. So that's how you do that position right there. And lastly, we have T37, which is the physio ball lat pullover with weight. Patient rolls the ball out to where you can relax your neck on the ball in between the shoulder blades also. The weight is positioned right above the head. Notice where his hands are. Feet are shoulder width apart to help with stability. This muscle is for the lats. You'll see these lats right here. The weight goes behind his head, arms are straight, about even with the forehead there. He's just going to pull to where it's perpendicular, okay? Once it goes past that, really gravity's helping and it's not really doing much at all. So, let's go back nice and slow, controlled breathing, just going right up to perpendicular there. And really squeeze and have the patient contract those lat muscles. And the ball just challenges the core while they do this exercise. And that is T37 physio ball lat pullover, and that's concludes phase 3 in all the phases of the thoracic spine.